name's Nicole Long. I'll be doing the healthcare comparison between the United States and Poland. So I'm going to go straight into the healthcare system of the United States. We have many laws and reforms that have passed over the years to make it what it is today. One of those most recent reforms and laws that have been passed is the Affordable Care Act. The Affordable Care Act is also known as the Obamacare Act. This has been the most recent one that has been passed. It's had a lot of stipulations behind it and a lot of uprisal. Just depends on who you are and what you think about it. But so just depends. Uh, we also have Medicare for children under 18 who don't have insurance, and for those with low income. We also have Medicare for the elderly, which are 65 and older, and for those who are disabled. For those of us who do not have Medicare or Medicaid, we have the HMOs and PPOs that we usually select from. There's other plans as well, but those are the two that are main competitive. We usually get them through our employers. Those are the employer health plans that usually get them through. There's also big organizations coming out in the healthcare system in the United States called ACO systems. So ACO systems are groups of doctors that are working together, not just primary cares, but specialists as well that are working with patients' files and they're transferring their data, which is wonderful because a patient's able to go see a specialist and still have all the knowledge that the primary care has. The public health care is pretty prevalent within the United States. It is paid for locally through the state and nationally, so depending on different different departments and different levels, it is paid for. So it's pretty prevalent. So we have the pros of the United States healthcare system. New reforms are always trying to lower costs and make it better for patients. It's great. They have tried to push it to always lower costs and make it better for patients. Those laws closely regulate to keep patients safe and not taken advantage of. They always put the patient first. Patients are always first in healthcare. That is the main concern. The ability to choose the insurance provider you want and have a competitive rate. That is the main thing. We also have a marketplace now with the Affordable Care Act that you can get competitive rates from. You will always have the right to treatment even if unable to pay. If you don't have insurance and you're broke and you walk into the ER with chest pains, you're going to get seen whether or not they can whether or not you can pay or not. It's nice. Very nice in the United States. Because a lot of countries, they will not see you if you cannot pay them. And right there on the spot. So, United States is a little bit different on that. The cons of the United States healthcare system. Even though it's making it easier on patients with the reforms, it's making it harder on healthcare providers because we're getting stressed and burnt out. It's putting a lot of burden on us because it's constantly pushing us to get better, which is not usually always bad, but it's pushing us to take on more work when we don't need it as much. um, Putting 80 patients on one person is a little too much, if you know what I mean. So burnout and suicide rates are a lot higher for medical staff because of the stress. The laws protecting the patients can cause doctors to overtreat, which can cause a lot of Medicare fraud and many other issues. So, what can help the patients can harm the doctors and harm Medicare. So, we have to find a really good balance in between. You have to make sure that you don't overtreat while still making sure to treat enough to not be negligible. So, you have to be right in the middle. Advancing technology is really hard to keep up with. We have telemedicine now, so it's always advancing and really hard for new training and to keep up with all the new databases, all the new tech that's coming out. But in medicine and administration, it's kind of your job to keep up to date with what is new. Then we go on to the Polish healthcare system. The Polish healthcare system is currently in a rebuilding stage after joining the UN in 2004. They didn't join until 2004, so they were really late on the running. Their major reforms just got put into place to restructure medical needs in that country because they were completely needing to be redone after 2001. They were kind of falling apart. They really didn't know how to run themselves. They never really ran themselves before. They've been kind of run by other people before, and this time they needed to be run by themselves, so it needed to be done. They're not technologically advanced in the medical field at all. They're really behind on that. Disabled communities are having really hard time because they have a huge percentage of them and they're not technologically advanced. The excess of medical staff are really underpaid, so they get bribed. That's gotten better within the last years, but still. The huge hospitals they have are underkept, which means they're falling apart. And Poland provides universal health coverage for its citizens at a fixed rate. That's 6% of its gross domestic product. So, whereas we have private insurance, they have the universal coverage for its citizens. That's like many of the European countries, which is apparently a very, very big thing over in Europe. Poland is a bit different from other countries, so I actually seen their 6%, and they seem pretty safe at their 6%. They're undergoing reform that seems to be taking well in that country. So this is the pros of their system, and that's good that they've been taking their reforms great, and that the country shifted easily, very easily, and they have huge hospitals. Even though they may be crumbling, they have huge hospitals over thousands of beds. That's wonderful. The cons of them, though, clustering in healthcare field didn't work because they're rebuilding and they're not going to be able to figure out clustering in the healthcare field yet. They're having to bribe doctors to say, well, right now, that's just not what you want to hear. Medical staff are underpaid. You have an excess of them. That's sad. It's great that you have a lot of doctors, but it's not great that they're getting underpaid and that you have a bunch of them in incorrect areas. And the hospital is not being kept up. If you have a huge hospital, it needs to be kept up. You don't have the funds, so I don't know. And they're unable to care for the disabled ones. They have 18%, and it grows further and further. 18% of the country. Again, they're technologically behind. Almost 30% of the citizens in Poland do not use the internet. That's unbelievable. Unbelievable. The comparisons are good, though. We're both in reforms. Them with Medicover and joining the UN. Us with the Affordable Care Act. Our overutilization of healthcare services didn't seem very common, which is wonderful. And our emergency rooms experience overcrowding in both areas. Regardless of the nation's choice of healthcare, their safety, efficiency, and effectiveness is absolute priority, which is perfect. And their patients' well-being is in the forefront of the physician's mind. The clinical and professional issues also seem the same. whereas primary care specialist tensions over patient responsibility and emergency department overburdening because patients couldn't go to their primary care specialists or physicians seemed pretty universal. The contrast between the two. Poland provides universal health care coverage while we provide private insurance. Poland's actually less obese than we are. They have no problem, they have a lot less problems with obesity and overweight and stress. Whereas us, obesity and stress is a really, really high rising health concern in the US. And our ability to break down the physician and the hospital services separately is something that the Polish system is not able to do, but they have been wanting to do because of the fact that the US system is able to be doing it. So they sat down together and they were working together, so that's interesting. In conclusion, the systems are different because they share similar problems, although overcrowding of primary care versus specialist tensions. The Polish population is much healthier and fit compared to the US, who suffer from increasing obesity and stress. Go figure. And the GDP that has been steady seems to be how the government has maintained a reform. So that's really great that their reform has been maintained by this 6% of their gross domestic product. And they've been able to be steady on that for several years now. Officials want to put the patient first no matter what country it is, which is wonderful. And then countries are always wanting to improve and learn so they can talk to each other, see if they can switch further programs such as Poland talking to the US. I also have my references on the 2 back slides, and that is all. Have a great day and happy Easter.